Welcome to the new patient chemotherapy class for patients and families. This class is for all patients who will be starting chemotherapy at the Dr. Douglas A. McIntosh Cancer Clinic. We will cover important information to prepare you and your family for receiving chemotherapy. In this class, you will learn about what to expect during chemotherapy, how to manage possible side effects, and how to look after yourself during chemotherapy. This class covers general information. Specific information about your treatment protocol will be given by your cancer care team and by the chemotherapy nurse and pharmacist when you have your first treatment. Please keep a notepad on hand during this presentation to write down questions for your cancer care team to answer later. You should have been provided with a blue teaching binder at a previous appointment. These slides are included in that binder along with other materials I will refer you to. Over the course of this presentation, we will explain who your cancer care team is and who to call, talk about what chemotherapy is and how to use it to treat cancer, explain the common side effects of chemotherapy and how to manage them, share some resources to help you and your family cope during chemotherapy treatment, and lastly, I will talk about what to expect on your typical visit to the cancer center once you have started treatment. There are so many people involved in your care at the Cancer Center. The team works together to give you and your family the best care and support during your cancer journey. You and your family are the most important members of the care team. You know best about your health, your values, and your needs. The rest of the team will work with you to provide care that focuses on your needs and goals. The healthcare professionals involved in your care will depend on your individual situation. Beyond our doors, you will still need to keep in close contact with your family doctor. They will continue to provide care and order you routine medications, as well as manage any pain medications that you may need. You may need to make an appointment with them at some point along your journey. The Southeast Lynn community nurse will also provide care as needed while you are at home. Other team members you may encounter include pharmacists, our social worker, and our drug navigator. If at any time, if your problem is a medical emergency, go directly to your nearest emergency department or call 911. I'd like to refer you to the After Hours Symptom Management handout at the front of your binder. This includes the yellow fever card. On your first treatment, you will be provided with an After Hours Symptom Management patient information sheet. This includes your diagnosis, oncologist, current protocol, and up-to-date medication list. It is essential you have this information with you anytime you call one of our care lines or present to the emergency department. This will help the nurse provide the most appropriate support. During our clinic's working hours, which are shown on this slide, you can contact an oncology nurse at our clinic for any questions or concerns related to symptoms or side effects of your treatment. An after-hours care service called CarePath provides telephone service from 4 p.m. until 8:30 a.m. CarePath is supported by oncology certified nurses that can answer your questions related to symptoms or side effects. They will notify us by fax if you have contacted them, and we will follow up with you as soon as possible if needed. While on treatment, you have 24-hour access to an oncology certified nurse by phone. Also available is your Southeast Lynn community nurse, also known as your home care nurse. So what is chemotherapy? Depending on your type of cancer and goals of treatment, there are a number of different kinds of treatment you and your oncology team may use. These include surgery, radiation, chemotherapy, or a stem cell transplant. This class focuses on chemotherapy and how it works. Chemotherapy is a drug that destroys cancer cells or slows them from growing or multiplying. It can target cancer cells in other areas of your body that radiation or surgery may not reach. Chemotherapy can be used alone or together with other forms of treatment, and the type of cancer you have determines the chemotherapy drugs that you will receive. There are hundreds of different chemotherapy drugs, and your treatment will be tailored to your diagnosis. How is chemotherapy given? You may receive one chemotherapy drug or a combination of different chemotherapy drugs. The specific treatment plan is often called a protocol or a regime. Chemotherapy drugs can be given in different ways. How they are given depends on what type of drug you're receiving and the type of cancer that you have. Chemotherapy can be given by mouth as a pill, capsule, or liquid. It can also be given by infusing directly into your vein using an intravenous, also known as an IV, or by injection under your skin using a small needle. If you receive your chemotherapy through an IV or through the skin, it will be given in our treatment room. When you come for your first visit, we will give you a brief tour of our space at Quinney Healthcare. Treatment schedules. Chemotherapy is often given in a series of cycles. Each cycle includes a clinic visit, a treatment visit, and recovery days after treatment days or after a treatment day or days. Generally, it is 7 to 28 days between treatments. The recovery days allow your body time to recover from side effects and give you your healthy cells time to repair themselves before being treated again. Your cancer care team will talk with you in detail about your individual treatment plan. If you take tablets or pills to treat your cancer, your cycle will include a clinic visit and you will receive instructions on what your cycle will consist of. Your prescription will be done on the day you see the doctor and will be faxed to your community pharmacy. For patients receiving IV medication or injections, you will also be scheduled for treatment visits. The length of infusion time or treatment days will depend on the type of drugs you are receiving. This can range from 15 minutes to 6 hours. So, taking care of your emotional health. We are going to focus quite a bit on the possible physical side effects of treatment, but we feel it is important to talk a little bit about taking care of your emotional health at the beginning of this session. We know that this can be an overwhelming time for you, especially if you are dealing with a new diagnosis or starting a new form of treatment. Feelings of anxiety and sadness are normal for patients and families coping with cancer. We encourage you to share how you are feeling with loved ones and with your cancer care team. It helps to talk, and it also helps others in your life understand how they can help you. If your feelings continue and start to interfere with your ability to do regular activities, you should seek extra support. Let your doctor and nurse know how you are doing. On the screen, we have listed some things that you can do to help your emotional well-being. Find support. This can make you feel better and less alone. There are social workers available who can provide you with additional support and navigation for coping with emotions and practical or financial issues. Focus on things that make you feel better. Think about the positive parts of your life and things you can control. Take care of your body. Eat well, exercise, and improve your sleep. Make lists of calming, enjoyable, and useful activities. When you feel anxious or down, get out your list and choose an activity. Try relaxation activities. These can help you relax and manage your feelings and stress. Get counseling to help you cope. Learn different ways of thinking and acting to help you cope. Chemotherapy is effective at destroying rapidly dividing cells. However, chemotherapy can't tell the difference between a healthy rapidly dividing cell and a cancer cell. This explains why we have some damage to our normal cells. The normal cells that are most commonly affected by chemotherapy are blood cells, cells in the gut, cells in the mouth, skin and nail cells, and our hair follicles. This damage to normal cells is the reason for many of the side effects people experience. The most common side effect of chemotherapy includes the items that are listed on the slide before you. Each of these side effects will be explained in more detail. It is important to remember that everyone reacts differently to chemotherapy. Many people worry that they will have the same experience as someone else they know who has had chemotherapy. Even people who are taking the same kind of chemotherapy may react differently. It is important to not compare to others. Side effects depend on the type of chemotherapy you receive, the dose you are given, and how your body reacts to the chemotherapy. You may experience none or some of these side effects. Your cancer care team will go over the specific chemotherapy you will get and the side effects you can expect to have. They will continue to assess you for these side effects while you are being treated. It is important to tell your cancer care team what side effects you experience so they can help you manage them. The biggest part of managing side effects is understanding them. So for each effects, we're going to go over 3 important points. 1, what to expect. 2, what you can do to manage the side effect. And 3, when to get medical help. More information on managing side effects can be found on the drug handouts you will be given and in the Canadian Cancer Society booklet, Chemotherapy and Other Drug Therapies, located in the back of your binder. Please refer to the Cancer Care Ontario website listed here for additional information on symptom management support. One of the main side effects of all chemotherapy is that it lowers the amount of blood cells floating around in your bloodstream. There are 3 kinds of blood cells: white blood cells, platelets, and red blood cells. White blood cells are part of your body's immune system. They defend your body against viruses and destroy bacteria. Platelets are cells that help your body to clot. Normally, when you cut yourself, platelets make a clot so the bleeding stops quickly. Red blood cells carry oxygen to all parts of your body. To monitor your blood counts, you will need to have regular blood tests. This is the only true way to know if your blood counts are low. Your cancer care team will check the results of your blood tests before each chemotherapy treatment you receive. If your blood counts are too low, your treatment may be delayed by about a week to make sure your counts do not drop to a dangerous level. Next, we will talk about each type of blood cell and how they can be affected by chemotherapy. When your white blood cell count is low, it is also called neutropenia. A drop in the white blood cells usually occurs about 7 to 14 days after your chemotherapy was given and lasts for a few days. What you need to remember about low white blood cell counts is that it means you have less defense against germs and are at risk for infection. Because you will not be able to detect when your white blood cell count is low, it is important to make sure you do what you can to avoid infections. Some examples are washing your hands often, especially after eating and after going to the bathroom. Carry a small bottle of water or a small bottle of hand sanitizer for when you can't get to the sink. Avoid anyone who is sick. Stay away from anyone who has a cold, the flu, or an infectious disease. Anything that can be passed from one person to another. Refer to the yellow fever card located in the front of your binder. One sign of infection is fever. For this reason, it is important to check your temperature with a digital oral thermometer twice a day, morning and night, and if you feel hot or unwell, for example, you're feeling as though you're having chills. If you are having difficulty obtaining a thermometer, please let the clinic staff know. If you are using Tylenol for pain management, ensure you take your temperature first to ensure you don't have a fever. We do not want to mask the fever if it is present. Here are some things to avoid while on chemotherapy, either oral or IV treatment. Please read the slide. Please read the slide indicating things to think about when living with an altered immune system. Most consideration should be given to the environment around you. Think about where germs come from and how they are passed along. Always, always, always clean your hands. There are a variety of signs of infection for a chemotherapy patient, and not every patient experiences the same ones. It is important to know that often fever is the only sign of infection. When you check your temperature, if it is 38.3 degrees Celsius or higher, go directly to your nearest emergency room with your fever card and patient information sheet. If your temperature is 38 degrees Celsius, check it every 15 minutes for 1 hour, and if it remains 38 degrees Celsius or greater, go directly to your nearest emergency room with your fever card and patient information sheet. Do not wait and see. Regardless of how you are feeling, you must present to the emergency department if you have met the criteria listed on the slide with your fever card and patient information sheet. You will not know if you have a low white blood cell count and you need to be assessed because this may be a medical emergency. Some other signs of potential infection include loose bowel movements, chills or sweating, burning or frequent urination, severe cough, sore throat or mouth sores, and an open area that appears red or swollen. If you experience any of these symptoms, even if you feel well, it is important to call your cancer care team, either the clinic or the after hours line, or go directly to the emergency room right away. Chemotherapy drugs can cause your body to make fewer platelets. Without enough platelets, you may get bruised even when you haven't bumped into anything. You may bleed easily from your nose or mouth or get a rash of tiny point red dots. If you have a low platelet count, preventing bleeding from an injury is important. Things you can do are use a soft toothbrush. If you floss, do so gently so that you do not bleed. Use an electric razor so you are less likely to cut yourself. Avoid activities that may result in injury. Avoid getting constipated because straining can cause bleeding. Do not take aspirin or ibuprofen, herbal supplements, or any new medications without speaking to your cancer care team first. Some medications can increase your risk of bleeding. Call your doctor or nurse if you have any unusual bleeding. If you cannot get in touch with your cancer care team, go to your nearest emergency department right away. Examples of unusual bleeding include unusual or heavy nosebleeds, red or pink colored urine, black tar-like stools, which are bowel movements or blood in stools, red or brown colored sputum or vomit, dizziness, constant headaches, or blurred vision. These may be happening with bleeding in the head, bleeding from your gums, especially when brushing your teeth, or heavy vaginal bleeding. Red blood cells carry oxygen around in your body. When your red blood cell count is low, you may feel more tired. For example, you may become out of breath when climbing the stairs. If you feel tired, make sure you save your energy. Pace yourself, take naps during the day if you need to, and try to take a short walk or exercise a little every day. Eat a well-balanced diet and drink enough fluids. Call your doctor right away if you feel dizzy, shortness of breath, or have headaches or ringing in your ears. If you cannot reach anyone, go to your nearest emergency department. These may be symptoms of anemia, which means your red blood cells are too low and the tissues in your body are not getting enough oxygen to do their job properly. Your doctor may suggest a blood transfusion. Nausea and vomiting can happen before, during, or after your chemotherapy treatment. For most people, it usually happens on the days you receive chemotherapy and for a day or two later. For some people, thinking about treatment can bring on nausea. Let your cancer care team know if this is happening. Nausea and vomiting is one of the most feared side effects of chemotherapy, but not all chemotherapy causes nausea, and nausea can be controlled very well by anti-nausea medications prescribed by your doctor. Different anti-nausea medications work differently, so you may be prescribed more than one drug to manage nausea. Your anti-nausea medications are usually ordered to take before and after your chemotherapy to prevent or reduce nausea and vomiting. Some of your anti-nausea medications are taken on a schedule prescribed by your doctor, and others are taken only when needed. It is best to take the as-needed anti-nausea medication as soon as you feel any nausea. Do not wait for the nausea to get worse. It will be harder to keep the pills down if you are already vomiting. Your care team will go over your anti-nausea medication schedule in detail with you on your first day of treatment. If you notice a pattern of when you get nauseous, take your anti-nausea medication at least 30 minutes before that time to prevent it. In addition to taking your anti-nausea medication, you can also try these tips. Eat smaller meals and snacks more often during the day. Sip water, juices, and other fluids during the day. Let other people do the cooking. Avoid spicy foods or foods with strong smells. Do activities that are relaxing. Keep track of when you feel nauseous or vomit and tell your nurse at your next visit. Call your doctor or nurse if you have vomited several times and can't keep food or fluids down for more than 24 hours, even if you're taking your anti-nausea medications as directed. If you cannot get in touch with a healthcare provider, go to your nearest emergency department right away. Some chemotherapy can cause sores in your mouth or throat. Symptoms of mouth sores are soreness, redness, and white patches in your mouth or tongue. You are at the highest risk of getting mouth sores around 7 to 14 days after your chemotherapy treatment. You can lower your chance of getting mouth sores by following these tips for good mouth care. Use a soft toothbrush and waxed dental floss. Remove dentures if your gums are tender. Avoid mouthwashes with alcohol as they can dry out your mouth. Use a baking soda mouth rinse. Avoid alcohol and spicy or acidic foods and liquids. If your mouth is sore, you may find eating soft, bland foods like cooked cereals, mashed potatoes, and puddings easier. If you develop an open sore in your mouth, tell your doctor or nurse. You may need some medicated mouthwashes to help treat the open sores. Open sores in your mouth have the potential to lead to an infection. Check your temperature if you start to feel unwell. Taste can change, including a metallic or lack of taste. Please read the slide for more information. If you have tried managing taste changes and there are no improvements, we can refer you to a dietitian for more information. Diarrhea can be another common side effect of chemotherapy. Diarrhea happens when you have soft, loose, or watery stools more than 3 times a day. It can be caused by chemotherapy, infections, or other drugs. Certain chemotherapy drugs cause diarrhea more than others. Your cancer care team will tell you how to manage this with the medications. It is important to tell your nurse if you have diarrhea, as it can cause other problems such as losing too much fluids from your body, weight loss, and fatigue. If you have diarrhea, rest and drink lots of fluids like water, juice, and sports drinks. Try to avoid caffeine and carbonated drinks as they can make your body lose more fluids. Avoid natural laxatives such as prunes, rhubarb, and papaya. Eat small meals often. If you are unsure at any point about your diarrhea, never hesitate to call the clinic during working hours or the after-hours symptom management phone line for guidance. If you are experiencing any of the following symptoms, please present to your nearest emergency room. If you have 6 to 8 or more loose bowel movements in a 24-hour period, blood in your stool, you feel tired, weak, or dizzy, you have little or very dark urine, or you are unable to eat or drink or are afraid to. Constipation happens when you are not having bowel movements as often as you are used to. When you are constipated, your stool is hard and dry, and having a bowel movement can be difficult and painful. Like nausea, it is important to prevent or reduce constipation before it gets worse. Your doctor may suggest stool softeners and laxatives that you can buy without a prescription, but be sure to talk to your doctor before taking anything. If you find you are constipated, try adding more fiber to your diet from foods such as whole grain breads, fruits and vegetables, dried fruits, and prunes. Drink plenty of liquids during the day and be more active if you can. Some patients find that constipation is a more frequent problem than diarrhea because anti-nausea medications usually cause constipation. Constipation can be prevented and managed with medications. Nutrition is an important part of your cancer treatment. Eating well can help you to maintain your body weight, improve your energy and strength, decrease the risk of infection, and assist your body with healing and recovery from cancer treatments. Eating well can be difficult depending on the type of cancer you have and the treatments you receive. Registered dietitians are available to help you meet your nutritional needs before, during, and after chemotherapy. A registered dietitian will provide a nutritional assessment and help you set realistic goals, help you manage symptoms or side effects related to cancer and treatments such as unintentional weight loss, loss of appetite, trouble swallowing, taste changes, sore or dry mouth, nausea, vomiting, diarrhea, or constipation. And they can also help you with nutritional support if needed during your treatment. You can ask a member of your cancer team to refer you to a registered dietitian. Hair loss can occur gradually or quite quickly. It often begins 2 to 3 weeks after chemotherapy starts. Hair loss can occur on all parts of the body. Head, the scalp may also feel tender. Your face, some or all of the eyelashes of your eyelashes and eyebrows may fall out. And body, some or all of your pubic, chest, or underarm hair may fall out. Not all chemotherapy causes hair loss. Find out from your nurse or doctor if chemotherapy may cause your hair to change so you can know what to expect. If you are receiving a type of chemotherapy that causes hair loss, it usually occurs 2 to 3 weeks after treatment begins. Hair loss is usually temporary and may start growing back during treatments or 3 to 6 months after treatments finish. Hair loss can happen anywhere on the body, your eyes, brows, face, pubic areas. And it is one of the hardest symptoms to cope with, both physically and emotionally. Some patients have found these tips helpful. Prepare your family and friends. Get a short haircut before treatment starts. Find out about options for paying for wigs. Some insurance and medical plans cover the cost. It can also be deducted as a medical expense on your income tax. Choose a wig before your hair falls out. Be gentle with your hair. Use mild shampoo and avoid hair dyes, perms, or straighteners. Protect your scalp from the sun. Try to use a satin pillowcase. Satin creates less friction than cotton and may be more comfortable for you when you sleep. There are some options available to you for hair care and accessories during cancer treatment. Free hand-knitted hats in chemo treatment area and Patients and Family Resource Center. Reconditioned wigs for reuse in the oncology waiting room. Look Good, Feel Better program runs frequently in Belleville. And we have a fact sheet in the clinic with a list of local businesses that sell wigs and hair accessories. The Look Good, Feel Better program offers women's tips to manage appearance related to side effects of cancer, including how to care for your skin and nails. Contact information can be found on the Canadian Cancer Society website or in the clinic. Chemotherapy can make your skin drier and more sensitive to the sun. Your nails may become brittle and cracked. These changes usually go away once treatment is over. Try the following to reduce changes of having dry skin and cracked nails. Bathe in warm water instead of hot water so your skin does not dry out. Wash and moisturize your skin using alcohol-free and exfoliant-free soaps, creams, and lotions made for sensitive skin. Avoid direct sunlight. Use sunscreen with an SPF of 30 or greater. This is important year-round as skin can still burn in the winter. Use cuticle cream instead of cutting the cuticles of your nails. Do not squeeze or scratch pimples. If you notice changes to your skin and nails, be sure to tell your nurse or doctor at your next visit. Remember, the Look Good, Feel Better program offers women tips to manage appearance related to side effects of cancer, including how to care for your skin and nails. Fatigue can be described as a feeling of tiredness or having a total lack of energy that does not go away with sleep or rest. Cancer-related fatigue is more severe and lasts longer than other types of fatigue that you may have felt in everyday life. Most people with cancer will experience cancer-related fatigue at some point along their journey. For many, it can be very distressing. The best advice to follow is if you feel fatigued or tired, listen to your body. Stop what you're doing and rest. This could mean stopping in the middle of vacuuming and finishing later, or asking someone else to do it. Some ways to reduce or manage fatigue and help you feel better include: plan the most important things first thing in the morning if that is when you have the most energy. Rest during the day but leave long sleeps for the nighttime. Try not to nap longer than 1 hour. Go to bed and get up at the same time every day. Try light exercise like walking. Studies have shown that exercise helps to combat fatigue. Eat a well-balanced diet. Try smaller, frequent meals and drink lots of fluid. Accept help from family and friends. When they offer, let them. Fatigue may continue after your treatment finishes. Keep your nurse and doctor up to date on how fatigue is affecting you. A small number of people will notice problems with memory and concentration. Sometimes this is called chemobrain or mental fatigue. This can include having trouble with short-term memory, such as forgetting where you put things, what you've been talking about on the phone, or phone numbers, being easily distracted, tiring easily when you are doing things that need mental energy. It is unknown exactly how chemotherapy affects the brain, so it is not clear if chemotherapy directly causes these problems. Changes in memory and concentration can be very subtle and mild. Mild cognitive problems tend to respond well to rehabilitation efforts, such as cognitive retraining techniques and exercises. Exercise your brain with crosswords or puzzles, painting, playing an instrument, or learning a new hobby. This slide is a quick summary of when you can expect certain side effects to occur. A reminder that not everyone will experience all side effects shown here. Your doctor or nurse will give you more information about the specific side effects you can expect to have. Some types of chemotherapy can cause sexual changes. These changes are different for women and men. There is also a lot going on emotionally and physically during treatment that can affect your desire for sexual activity, your physical sexual functioning, and changes to your sexual response. Here are a few things to remember during chemotherapy treatment. You can talk to members of your cancer care team about sexual changes or side effects. It may be an uncomfortable subject to bring up, but sexuality is a big part of quality of life for many people, and we can help you. Be open and honest with your spouse or partner. Talk about your feelings and concerns. If you're having sex less often, try activities that make you feel close to each other. Use a condom for 7 days after you receive chemotherapy because a small amount of chemotherapy may be present in semen or vaginal fluids. If you or your partner are able to become pregnant, you must use birth control. It is very important that you not get pregnant while having chemotherapy. Chemotherapy can hurt the fetus, especially in the first 3 months of pregnancy. Talk to your nurse or doctor about birth control and ways to keep from getting pregnant during treatment. For more information, see the handout on sexual activity and systemic therapy provided in your binder. Some chemotherapy can cause fertility changes in both men and women. Infertility is the inability for women to become pregnant or for men to get a woman pregnant. Whether or not your treatment will affect your ability to have a child depends on which drug you are taking, your age, and your general health. Not all chemotherapy drugs lead to permanent infertility. If you plan to have children in the future or think you might want to, tell your cancer care team as soon as possible. Talk to your doctor before starting treatment so they have as many fertility options as possible. It is important that you safely handle any bodily fluids for 7 days after each IV chemotherapy treatment. If you are taking oral chemotherapy, you will need to be safe continuously. Your bodily fluids include urine, vomit, stool, blood, semen, and vaginal fluid. Safe handling is important because small amounts of chemotherapy are in these bodily fluids. Chemotherapy works to treat your cancer, but it can be harmful to others if they come in contact with even a small amount. This is why you will see nurses in the chemotherapy treatment area who administer your chemotherapy wearing protective gowns and gloves. Safe handling precautions should be taken after each chemotherapy treatment. They are included on this slide. It is important to remember that hugging and kissing is safe. You can still be around small children. Please note that some treatments do not require safe handling precautions. Ask your nurse if you have questions. In this section, we will cover what you can expect on the days you receive chemotherapy treatments, including the types of appointments you will have and what to bring with you to your appointments. During chemotherapy treatment, you will generally have 2 kinds of appointments. One where you will see a nurse and doctor, and the other where you will receive your treatment. How often you will have these visits depends on your specific chemotherapy protocol. We will go through what you can expect on these days. Step 1. Register at the registration desk in the oncology clinic waiting room. A typical clinical visit will start with getting your blood work done. Your blood work allows the cancer care team to check your blood counts and make sure your body is healthy enough to receive treatment. Verify with your nurse whether you should have your blood work done before or after your visit with the doctor. You will then have a checkup with your doctor and nurse in the clinic. They will assess you to ensure you are fit to start or continue chemotherapy treatment. Remember, this is your time to tell your doctor or nurse how you've been doing and explain any of the side effects you have had. Some people find it useful to write notes or questions down on a notepad and bring it with them to their doctor appointments so they can cover all their questions and concerns. Bring up any questions about prescriptions at this visit. You will be told at your clinic visit if your chemotherapy treatment needs to be delayed for any reason, like your blood counts are too low. Your Symptoms Matter questionnaire will be given to you when you register at the reception desk. Please complete this form and return it to the reception to be put with your chart. When you fill out the questionnaire, the scale relates to how you are feeling that day. Please do not forget to tell us about any difficulties or side effects or symptom changes you've had since your last visit. Once your chemotherapy is being prepared by the pharmacy, a nurse will start giving you your drugs through the IV. Before that, the nurse will give you any pre-medications you may need to control nausea or reduce the chance of reaction to chemotherapy. The nurse reviews all your blood work and checks your chemotherapy dosing again before she gives it to you. She will ask your name and birth date and compare it to her paperwork on your wristband. A second nurse does the exact same. The nurse will check on you regularly and take your vital signs, which include your blood pressure, heart rate, temperature, and oxygen levels. Most patients do not feel pain or anything unusual while they get their cancer drugs. If you do, tell your nurse right away, even if you don't think it's important. After your first treatment, you will probably get a prescription for medications to help with side effects like nausea. We can fax this prescription to your community pharmacy so you can pick it up on your way home. Be sure to pick up your next appointment at the chemotherapy clinic reception desk before you leave. Please read the slide on your first treatment for IV chemotherapy. Be prepared to be at the cancer center for several hours on treatment day, so always bring what you need to stay comfortable. Always bring your health card to every visit. Bring food and snacks. Drinks will be offered free of charge. Bring anything that helps you to stay occupied. There is free wireless internet. You may also bring one support person with you to stay during the treatments. For safety reasons, children under 18 are not permitted in the treatment area, as well as anyone who is pregnant. You can use your cell phone in the treatment area. Following your treatment, you will need to pay for your parking. Parking passes are available, which will help reduce the cost and can be purchased at patient registration. Your treatment plan may include drugs that are not paid by the Ontario Health Insurance Plan. For this reason, it is important to know what kind of drug coverage you have before you start treatment. Members of your cancer care team, like our drug navigator and social worker, will help you figure out if your drugs are covered and explore drug coverage options. Nobody should be having big bills at the pharmacy. If you have an unexpected cost, don't hesitate to call the clinic immediately to explore your options. Sometimes you will have a prescription sent home with you following your treatment. You will have to stop at your pharmacy to have these filled. If you are looking for more information about cancer and its treatment and living with cancer, please take a look at the patient handout wall in the clinic waiting room. There are also some services and resources laid out on this slide. If getting into the hospital is concerning you, the Canadian Cancer Society can provide you with a driving service for getting to medical appointments. Call the Canadian Cancer Society for more information. Please remember these key takeaways. Know when to present to the emergency department with a fever. Please refer to your yellow fever card. Know that you have access to an oncology certified nurse throughout the oncology clinic and after-hours symptom management phone line. Never hesitate to call. Thank you for taking the time to review our teaching presentation. When you come to the clinic for your first treatment, please be sure to bring any other questions you might have so that you can review them with your nurse. Thank you.